And we are back with Steve Edmonds of Alliance Insurance Services and Catherine CVA with AARP. They're answering your Medicare and health insurance questions. Catherine, this person's asking, do you have to be a certain age to get Part D of Medicare?
Part D is part of the whole Medicare plan, so you have to be signed up for Part A and Part B before you can get Part D.
Okay, but you just have to be 65, right? It's not like you have to wait till you're 67 or anything like that. Okay.
No.
This person says, how can I avoid being in the donut hole? Let's explain what the donut hole is, Steve.
Okay, so typically the donut hole comes into play when the total of your medications for a calendar year has surpassed $4,800. Now, when I say that total, that's what you've paid out of your pocket in copays, plus what the insurance company has paid for the drug on their end. So when you go into the donut hole, it doesn't mean that your coverage stops. It simply means that you'll pay a little bit more on your prescription. So instead of paying a really small copay, you might pay maybe a medium copay, or it'll be more, but you're still going to have coverage. So I wouldn't let that scare me. You'll still have coverage. You'll just pay some more.
Okay. All right. Catherine, this person says, I'm turning 65. I have military TRICARE, but all these companies are trying to set me up with additional Medicare supplemental insurance. Do I need that?
When you turn 65 and you go on Medicare, you will move over to TRICARE for Life. And TRICARE for Life becomes your secondary insurance, much as if you went to another company to get that insurance. So you do not need them.
You do not need them, yes. There's lots of commercials and ads and stuff saying that you need all kinds of things. If people have questions like that, I know, Steve, they can call you, an insurance agent who is unaffiliated with anybody else, and ask those kinds of questions. But Catherine, who else can they call?
Well, they can look online at AARP. They have a great section in there. There's also the North Carolina Insurance Commission has a program called SHIP, S-H-I, two I's, IIP, and they can not only help you understand the Medicare pieces of it, but if you need some financial help with finding some relief because you're lower income, they can help you determine what you might be eligible for as well.
Mm-hmm. And if you really need some of that extra coverage. Steve, this person says the Social Security Administration is charging me extra for my Medicare coverage due to me receiving my pension the year that I retired. Well, now they want proof I won't make that much every single year. Why can't they just look at my records?
Well, that's a question that you would have to pose to Medicare itself. But typically, Medicare is going to charge if you're what they consider to be a high income earner. They are going to charge you more on the Part B premium. Typically, the Part B premium is $164 a month and some change. And they will charge extra if a person's income it exceeds X number of dollars, and that's probably why that they're getting this extra charge.
But all those, like the administrations and Medicare and stuff, they don't all talk to each other. They don't all share databases.
No, they don't. We find that all the time with Medicare and also with the Affordable Care Act plans. They'll ask people to prove their income on that as well. So yeah, it's not like they're sharing information, even though they're federal entities. You still have to prove these things to them when they ask for it.
And they do access your tax records as well to see if you go into that higher income bracket. So you may get a letter at the end of the year telling you that your premium has exceeded if you have hit that higher income bracket.
Mm-hmm. This person says, when you turn 62 and you apply for early retirement, I'm guessing that's Social Security, why do you have to wait so long for Medicare?
The law says 65.
That is it. Like, we don't make the laws. That's just how they have it, right?
Yep.
Okay. Right. This person says, if I'm still working and I have insurance, and after signing up for Part A, can I sign up for the additional parts later without penalty?
Yes. As long as you have deferred Part B, And then at some point in time in the future, when you retire, you would still call Social Security, say, hey, I'm retiring. I need to turn my Part B on. Now, what's going to happen? They're going to turn it on, and then they're going to ask you for proof that you had credible coverage. So you'll have to go back to your employer, to HR, and ask them for a proof of credible coverage form, which they will supply you. And then you have to send that into Medicare to prove that you had credible coverage through that gap in time from 65 to whatever age. And then you would not be penalized for that.
But make sure you defer that Part B and you call Social Security yourself.